Hello friends, myself Dr. Kanchan Durugkar. I am consultant at OASIS FERTILITY Pune. So in this video we are going to talk about ovum pickup. That is, it is a routine procedure that is carried out during your IVF treatment, IVF journey. Ovum pickup or oocyte retrieval. We are just going to talk about the surgical aspects of it. So what are the prerequisite or pre-treatment that we give on the day of OPU? What are the instructions that you need to follow? And post OPU, what are the cares you need to take? So uh, before OPU, your trigger is given. Wherever you are taking your fertility treatment, there the trigger injection is given. So you should be particular while taking the trigger injection. The timing should not be missed, and 36 hours post 35 and half hours post trigger, the ovum pickup is done generally, or if the number of eggs are less, then the after 35 hours the pickup is done. So on the day of pickup you need to come nil by mouth, and whatever pre-medications you are taking, that you need to avoid. Only thing that you can take is the thyroid medicine you can take. Otherwise other medicines you need to avoid. Even if you are on the anti-diabetic drug, you do need to avoid that medicine. And on the day of pickup, your baseline BP, your baseline SpO2, all things are measured, and basically if you are diabetic, your baseline sugars will be measured. Now on the before OPU, before taking you to for the OT, you are asked to empty your bladder. Pre-medications are given in the form of antiemetics and antibiotics. Then after you are taken to OPU, in the operation theater, a lithotomy position is given, and under anesthesia the procedure is carried out. Now this procedure takes half an hour, maximum of half an hour to 45 minutes. If number of eggs are more, then it may take 45 minutes around, but generally it finishes in half an hour. So OPU is done under short GA, and vaginality is done. So again, no incision is there on abdomen, and you don't understand anything. But after the OPU is completed, you are immediately awake. Some sort of sedation can be there. Now before OPU, you are told about how many number of eggs are expected by your fertility consultant, and how much are retrieved after OPU. That is discussed with you by your fertility consultant. And so the good quality of eggs depends upon your AMH. What is your AMH? What is your enter follicle count and your age? So these all factors affect the number of eggs that are retrieved during your ovum pickup. Also the surgical techniques also matters, and generally ovum pickup does not have any major complication, but some rarely there can be some trickling or vaginal spotting that can be observed and taken care of. Sometimes a major complication in the form of vascular trauma can be there. So for that operative interventions are required whenever there is a vascular injury. Now post operatively you will feel sedated for around half an hour. Then after that you need to take rest for 1 hour, and it is a daycare procedure. You can get discharged. If you are in daycare unit, you will get discharged after 2 to 3 hours of your ovum pickup. And post-op medicines has to be taken very meticulously in the form of antiemetics, analgesics, and sometimes antibiotics are also given, and sometimes for constipation some laxatives are also given. Then progesterone medicines can be given, and if you are having more number of egg retrieved, then sometimes some injectables in the form of heparin or low molecular weight heparin or antagonist injection or valvular solution can also be given. So post-operatively you need to take plenty of fluids, high protein diet, and take adequate rest for that day, and after 1 or 2 days you can resume your regular activity. So this is about the pre-op. Then during pickup and post-op instructions that you need to follow during your IVF journey. So thank you and take care.